have been in healthcare since 2001. I just felt a draw to healthcare. I had a very good vision, I guess, as a 17-year-old to sign up for healthcare, thinking that that's kind of where I wanted to invest my time, and I wanted to be there to help people and be able to connect to people in a really meaningful way.
Yeah, I grew up here. I actually was born in the same hospital that I was working in, and I've worked here for almost 6 years now. I've always kind of wanted to be in the medical field, nursing or care aid, and so yeah, I've been here about 5.5 years.
I've been working in healthcare for about 21 years, and I actually started working in care. Somewhere along the way, I got interested in working in rehab and was inspired by some of the residents that I worked with. So I went back to school, took the course, and graduated, and here I am.
Well, before I fell, I was having a good retirement, and then I had an unfortunate accident, ended up paralyzed like this. Well, I don't know much about the fall because I went into the bathroom to get worse, and the next thing you know, I woke up in Vancouver with tubes everywhere. And I just took one look at myself and said, oh my gosh, I've been in 3 different hospitals and of course now in the care home. And I retired in Brampton and moved out here to look after my mother in 2009. I got to know the area pretty good.
I think the Comox Valley is a very special place. It's a beautiful place.
It's funny because we were in Vancouver not that long ago, and as soon as I get back on the ferry and back to the island, it's like such a different feel for me. Like when I can see the water, I'm like, okay, I'm home.
I have called being out here in this space like being in an all-inclusive resort. We moved over from a 4-bed ward, and every resident here now has their own room, their own privacy.
We went from an extremely institutional model and building, and now we've moved to this new building that's really focused around the life of the resident and what that resident needs to try to normalize long-term care.
It was a lot more relaxing. Like it didn't feel like we were in an institution anymore, or a hospital. It was more home-like feeling.
You had your own room, and that was the greatest thing because you had your own privacy all the time, and you didn't have to worry about somebody walking in and knocking things over or taking your stuff. It was just a great feeling to have your own room.
I think just having the way they've changed the units, they're a lot more comfortable to come in because it's not like a hospital feel or like they're checking in. They can just come and see their loved ones anytime. And I think that's brought more visitors and more family to see their loved ones. I think it's made a really big difference.
That is the goal. That's what this is about here in this community. It's creating a community, a more family environment. Some of the successes coming over here is we found that some of the residents that generally wouldn't come out of their rooms are now coming out and participating in different activities, but in things that they used to enjoy. One of the gentlemen here, he loved to garden, but over at the Old Views, he never came out of his room. The minute we moved over here, he was out watering the gardens, pulling the hoses, and making sure that all our gardens here in our courtyard were taken care of.
When you go out into the courtyard and come out to some of the activities, of course, you get to see the members from other communities that you had seen before in the Old View. So it's kind of a nice little get-together where people chat and talk about, well, we remember the Old View and remember this view. They know my name and they know I have the wheelchair, so they know that I always go beep, beep when I go by them. I don't know, it's just more friendlier, I think, this way.
When you're thinking about caring for a resident in long-term care, you're looking at really complex situations focused around specific individuals that have individual and specific needs that are going to be different from the other folks living in their households. Having the right equipment allows us to focus our care plan and our interventions as healthcare professionals to what that resident needs based on their needs and abilities and goals and wants. I couldn't imagine doing my job without the right tools and devices and lifts to make that happen for people.
The technology of the lifts have definitely improved. Like having them being able to go into the bathroom in every single room has made a huge difference because in the old building, they didn't go into the bathroom. I don't know how a day would go if someone who needed the lift, if I didn't have it, how much longer it would take to get them out of bed or get them where they need to go. I can put their chair down, get them up. I don't have to worry about like having it, like it takes more time trying to position it in the right way. I can put it there, talk to my resident, get it ready, have them up, talk to them while I'm doing it because it's moving with me.
You're not really seeing all of the equipment per se. It's kind of behind the scenes. I think it's allowed people to feel more dignified, especially when we're using like an overhead lift. You're not in a room with 4 people. So if you're having some personal moments, they're your personal moments. They're not in a room with 3 other people. Now that we have received a new piece of equipment, what we found is some of our more petite residents weren't able to reach up whether it was due to shoulder injuries or not able to lean forward enough. And so the different levels of handles allowed the residents not maybe to have to reach forward as much or reach up high, and they were able to stand. So it transitioned them into be able to stand and have some dignity and that independence that, we all like to have. And Providence Living has always been about providing that equipment to their staff to be able to do their job to the best of their ability.
I have a schedule that I have for the week, and each session is different. Usually at 11:30 I have a session. I'm usually doing things with the sling type of thing to get my hands up in the air and then trying to get my hands moving more. Could be either the slings or it could be trying to feed myself with some cheesies.
So when I first started in long-term care, we did not have overhead lifts. We were using the floor lifts, which are amazing and super useful, but there is still more injuries involved because you're using your manual force to move them from one spot to another. The more advanced we get with our medical equipment and the tools that we provide our staff with, the better off they are. I know for me personally, somebody who's been hunching over beds for as long as me, my back has had a few injuries and does give me trouble. And if we have beds that are adjustable and lifts that are the appropriate lifts, and even just the right sized slings, it makes my job easier, safer, where I'm feeling better at the end of the day. And it's really important for us to take care of ourselves and our bodies so that we can keep doing this very, very important and very difficult work.
I made up my mind I was going to try and do things, and little by little they've all helped me along the way. And 2 years ago to now, if you saw me, you'd see the improvement. It's just out of this world.